the excruciating abdominal pain, the heavy bleeding, and the pain during intercourse just kept getting worse. And it started interfering with my marriage. So today I'm going to be sharing my laparoscopic hysterectomy story. And in it, I'm going to discuss why I had one at the age of 41. I'm going to discuss what the surgery was like and how recovery has really been for me. And it'll be recovery for weeks 1 through 4. So if you're looking for information because you're preparing to have this surgery and you're scared, nervous, anxious, or just plain overwhelmed, I hope my story brings insight, peace, and a little comfort to you because, for one, you will get through it. And even though I am still recovering, I can tell you this already that this has been one of the best decisions I have ever made for my life. So let's start with why I even needed a hysterectomy in the first place. Currently, I am 41 years old. I've been married for almost 8 years to my amazing husband, and we have two beautiful toddlers, a 4-year-old daughter and a 2-year-old son, both miracles in their own right. But before them, I went through 2 miscarriages, had a myomectomy, and I also had my tubes tied after my second child. Both of my pregnancies were very high risk, and although both of my babies were born completely healthy via C-section, I did develop preeclampsia with both of them, and they both ended up being born prematurely. So after my son was born, my husband and I both decided that we were done having children, and I wanted to get a hysterectomy before I even left the hospital. But my OB thought it was best to wait, and so I did. And one of the many reasons I wanted a hysterectomy at that time was because I had been battling with endometriosis, fibroids, and PCOS for years. And while I tried to manage it naturally, over time, the excruciating abdominal pain, the heavy bleeding, and the pain during intercourse just kept getting worse. And it started interfering with my marriage. It started interfering with my ability to parent and have energy. And honestly, it was really affecting my mental health and my peace. So, fast forward to 2 years after my son was born, I finally decided it was time to get it done, and my OB thankfully agreed. So on the day of surgery, I was scheduled to have a robotic laparoscopic hysterectomy, which in my case was a surgical procedure to remove my uterus, my cervix, and my fallopian tubes via robotic technology, which is what assisted the surgeon in my surgery. And the laparoscopic part meant that they were going to make 4 to 5 small incisions in my abdomen, and they do this in hopes of reducing pain, blood loss, and to have a recovery that's quicker than a traditional open surgery. Now, this wasn't anything new to me because, like I stated previously, I had a myomectomy before I had kids to remove fibroids and endometriosis, and it was also done laparoscopically with the Da Vinci robot. So everything my surgery day happened fairly quickly. My sister drove me to the hospital the morning of my surgery because my husband had just recently returned back to work from being on bereavement leave from death in his family. So I told him it was okay for him to go in and then just come to the hospital right after work because he goes to work at 5 in the morning. So I knew it wasn't going to be long after my surgery before he would be able to come to the hospital. And not to mention, my sister is an ICU nurse, so I was more than okay with her being at my side for my surgery. And honestly, I really only remember getting prepped for surgery. I remember talking with the nurse and this anesthesiologist right before they wheeled me into the OR. And after that, I woke up in recovery. And I believe I was only awake fully for maybe 5 to 10 minutes in recovery. And the next thing I remember after that is waking up in my room. So my surgeon and I both agreed to me staying overnight after surgery and planning on being discharged the next day. And I'm going to include a little video right now from that moment, right before I was discharged. So it's been approximately 24 hours. Since I had my surgery, I have been discharged. I had just saw my doctor. I'm feeling okay right now. Like I said, I just had my surgery 24 hours ago. It is a little after 10 a.m. right now, and I had my surgery yesterday. It was scheduled for 9:30, and not having any pain right now. Just a little bit of back pain, which I believe is probably gas. Um, I did go walking about an hour ago. Um, the pain has been bearable. Just when they ask me what's my level of pain, I tell them I really don't have any. It's discomfort. Um, in the bed, I'm okay. I just have my legs elevated, and when I'm resting, I have my head down some. But I have it up right now since I'm recording. But I don't really feel much until I get up and have to go to the bathroom. Um, I just feel, I don't know how to describe it. Um, like there's things in my stomach moving around. It is a little, my stomach does feel a little heavy. Um, and going to the bathroom when I have to urinate, at first I had to go really bad, but when I got to the bathroom, this was yesterday, I really couldn't like get my urine out. I had to push it out, and that hurt really bad. But today I am able to actually just go as usual. And when I get to the end, I do have to push a little to get the rest of it out. So honestly, that's been the most of my pain and discomfort. Um, Walking does feel good, but when I sit down, I'm exhausted. And I definitely could tell that I had surgery and something's went on. But other than that, for the most part, I've been fairly good. I did eat breakfast this morning. They gave me grits and eggs and turkey sausage. I did feel some discomfort towards the end of eating, so I stopped. I don't know if it was because it was too much or what, but I just kind of felt a little uncomfortable eating. I yesterday I did have something to eat. My husband brought me some ramen, and so I ate some ramen. I did pretty well with that, and then I just ate kind of like applesauce, and I had some Gatorade, and that was it for the most part yesterday. But of course, I'm in the hospital, so I didn't get much sleep. I rested here and there. They were coming in and out to check on me, check my vital signs. I had to get some blood work done. Um, Everything so far looks good. The doctor has discharged me to go home. I did stay overnight because I've had two C-sections within the last 3 years, and I have a history of having a DVT, which is a blood clot. So they just wanted to monitor me and make sure that everything was okay. And I will be taking Lovenox injections when I get home as a preventive measure for getting another DVT, but I'll also be up moving around as much as I can so that that doesn't happen again. But overall, honestly, I feel good. I'm in good spirits. Like I said, the pain is minimal. And I'm looking forward to going home. I will follow up probably tomorrow. I'll be keeping check on how I'm feeling for the next couple of days. And as long as nothing changes, I'll just give like one update when I'm probably about a week or two post-op. So I will be back with you all soon. So I was discharged about an hour later after making that video. My husband had arrived to the hospital a couple of hours after my surgery, like I stated before, and he stayed the night at the hospital with me. So after they brought me my discharge paperwork, he helped me to get dressed and we were ready to go home. Now listen, that car ride home, oh my goodness. That's all I can say is oh my goodness. Because the ride home was over an hour and a half, and every bump on that road felt like I was getting punched in the gut. So, my suggestion to you is to already have a pillow waiting for you in the car because trust me, you are going to need it. Even if you live 5 minutes from the hospital, you still have to wear the seatbelt over you on your ride home so that you'll feel some comfort and not have to have so much pressure on your abdomen. My suggestion would be to have a blanket, a pillow, or something of some sort to brace the impact that you'll be feeling from the ride home from the hospital. From watching other hysterectomy stories here on YouTube and hearing the stories of families or friends who had the procedure, I knew that weeks 1 and 2 of recovery would consist of a lot of rest and taking it easy. So I prepared myself mentally for that. And thankfully, I did because I wanted to have footage of each day or at least each week of my recovery, but I just really wasn't up to it. So, what I'm going to do is just go through different aspects of my recovery for those first 2 weeks and then get into the third week. So, first, I'm going to talk about showering. Oh my goodness. Showering, of course, for me, because like I said, I have 2 toddlers, showering is always one of the best parts of my day because it's the time I get to myself. Cleansing your body to me just feels so good anyway, especially when you're doing it after you worked out or when you're doing it right before you go to bed. But after this surgery, showering was a little different for me because I had to be careful because I had these incisions on my abdomen and I couldn't just put full pressure from the shower on my abdomen. So, most of the time in the shower, I had the shower running on my back. My discharge instructions did say I could clean the incisions or pat the incisions lightly, but not to the point where you're going to scrub or rub off the surgical glue that is placed on the incisions. And I had Dermabond placed on my incision, which is just a surgical skin tape that's used to close up a wound after surgery. But what I will say is, after I took my shower, I was exhausted and I literally just had to go lay down and get rest after that. So, taking a shower really wore me out. And it wasn't just my first shower when I got home, but literally all of my showers that I took within those first 2 weeks, they really wore me out. So, I always made sure that there was nothing in particular that I had to do after I took a shower because I knew I was going to be so tired. So I just made sure that the plan was to lay down or sit down after I took a shower because they were very tiring. My experience going to the bathroom wasn't really bad. I know a lot of people have said that they have issues with having a bowel movement, and that actually is typical after you have any kind of surgery. But I take magnesium daily as a supplement, so even prior to my surgery, I never have a problem going to the restroom. I go, and this may be TMI, but I go sometimes, I go at least once a day and sometimes even twice or 3 times a day. So I was prepared. I did have supplements in case I needed them, and I will be making another video on everything that I had to get before I had this surgery, but I didn't have to use anything to help me go to the bathroom. My first bowel movement was smooth. I had no issues and no problem with it whatsoever. Now, peeing, on the other hand, was a little different. I have always had issues with urinating, just in general, with frequent urination and urgency to urinate due to having the endometriosis. But after the surgery, I was able to pee fine, but I did notice that when I was almost done, that there would be a lot of pressure for me to actually push out the remaining urine that was in my body. So that was an issue for me, at least for the first couple of weeks. When I went to my first post-op visit, my doctor did end up giving me an antibiotic that would treat a urinary tract infection just in case I was attempting to get one. So after I took that, I did notice that things did get better. So outside of just that issue, going to the bathroom really wasn't a problem for me. Pain also wasn't really an issue for me. I was given pain medicine prior to my surgery to get filled, which I did. I was also given medicine for nausea. I was also given medicine for gas. And I was also, oh, how can I forget? I was given medicine for blood clots. So I previously had a DVT after my first pregnancy. And so any surgery or procedures that I've had since then, my doctor will usually put me on Lovenox, which is a blood thinner, in hopes of preventing me from getting another blood clot. So those were the medicines that I was on. My doctor did prescribe the medicines for me, although I could have gotten them over the counter. I did get things like gas X. I would recommend your doctor will do it to prescribe the medicines that you would need over the counter because my insurance covered all of those medicines. So instead of having to actually go purchase those medicines out of pocket myself, my doctor did prescribe them and I didn't have to pay anything for them. And thankfully, I did have the gas medicine on hand so that it was already at home when I got home from surgery because the gas, I almost would have preferred the pain rather than the gas because the gas pain is terrible. And I have a high tolerance for pain myself. So normally, like, it takes a lot for me to have to take something for pain anyway. I know that's not the case for everybody, but literally, like, I only needed to take ibuprofen throughout my recovery for the first couple of weeks. And a lot of that was due to back pain and things that honestly probably didn't have anything directly to do with the surgery itself. And that was because my doctor recommended that I lay on my back so that I didn't put a lot of pressure on my abdomen. And I'm not a back sleeper. I am a side sleeper. So I felt really uncomfortable sleeping on my back. I did have my legs elevated, but it helped a little bit, but not too much. And I also have reflux. So usually when I'm sleeping, I do sleep at an angle, and I was not able to really do that as much. And so I believe that's where my back and my neck pain was coming from. And I took ibuprofen for that. But other than that, my pain was very minimal within the first 2 weeks of my surgery. I part of my prayer for my surgery was to not have any pain or to have very minimal pain, and God did answer my prayer because I did not have pain per se from the surgery itself to where I had to take any of the pain medicine that was given to me for the surgery. And I will say when my family and friends were checking on me, and when I went to my post-op visit and they would ask about my pain, I would tell them that there was discomfort because I was very uncomfortable. Having a surgery in your abdomen area really does affect a lot of your movement. It affects you when you sneeze or when you cough, when you have to get up and down from sitting or get up or lay down and getting in and out of the bed. So there was a lot of discomfort. And like I'd say maybe the first at least 3 to 4 days, it was uncomfortable to be walking. And so I had to walk very slow and in most cases in the first couple of days with assistance. So I describe my pain as discomfort more than it was actual pain. I did do a lot of walking. Like I stated before, I was taking Lovenox injections, but I also made sure that I walked a lot. And my doctor, of course, reinforced that to me. Don't just lay down in the bed your whole recovery. One that doesn't feel good, getting up and moving does help you to feel better. And like I said, it also helps prevent you from getting a blood clot. And so, what she recommended for me to do is if I was going to be laying down, Every 2 to 3 hours, at least get up and move around. And so I would do that. I'd get up. I had to set a timer because sometimes I would fall asleep or I'd be into a movie or just busy doing things in the bed to try to keep my mind occupied. So I would set a timer on my phone for every 2 hours to make sure that I did get up. I also drink a lot of water. So most of the time, the alarm that I set, I didn't have to use because I was getting up anyway to have to go to the bathroom. So that did help a lot as well. And I just made sure that I was up moving around as much as my body would let me. Sometimes I would get up and walk around a little bit longer than I did before, but I couldn't do it as much as I wanted to do because my body would let me know it's time to sit down. Yeah, appetite was pretty much the same. I normally don't eat a whole lot anyway, but I did notice after the surgery that the first couple of days when I would eat, it was as if I could feel my food going down. And that felt very uncomfortable. So when I would eat only a little bit because I knew I needed to eat, especially if I was going to be taking any medicine like the ibuprofen or anything. So I did make sure that I ate. But like I said, for the first, I'd say maybe the first week, it was kind of uncomfortable digesting my food, but it did get better after the first week. One thing I didn't expect after this surgery was to be in the state of mind that I was in. I was so excited to have this surgery because, like I said, the majority of my life, ever since I started my menstrual cycle at the age of 10, I've always dealt with a lot of pain stemming from my cycle. So to be getting this procedure done and knowing that it was going to take all of that away, I was so excited about it. But after I had the surgery, I developed like this mental fog. I was expecting to be recovering and resting and get a lot of work done, especially pertaining to my husband and I's businesses, because I was going to be in the bed. But I found myself just kind of like staring off into space a lot for whatever reason during my recovery, at least the first 2 weeks. And I didn't get nowhere near what I planned to get done because of this brain fog. Now, I have dealt with brain fog previously, but it kind of had went away and I hadn't dealt with it in months. But after the surgery, it did kind of come back. And I'm not sure what that was related to. My sister did tell me that she noticed that happens a lot from her patients in the hospital after they have procedures done. Maybe it's from the anesthesia, but I definitely wasn't expecting that. So thankfully, I did have a few things prepared that helped me to kind of get through it. I definitely recommend having something that will help you take your mind off of anything that would give you a setback with your surgery, just not put you in a good mood because your mental state does matter. We are going through recovery from any type of major procedure or major surgery. So for me, I just made sure I stayed in my word. I read God's word a lot. I read devotionals a lot. And I talked a lot too, honestly. I had help here at the house while I was recovering. So family was coming in and out to check on me. I talked to my husband, of course, while he was home and on the phone when he was at work. And I just definitely recommend that you do have a village if you can around you that would just help support you and help get you through this process because it can be heavy. It is life changing. It is a major surgery. And so you want to make sure that you can get through this surgery the best way possible. I did not have any bleeding after my surgery. Thank God. I was expecting to have some. It was so funny because I literally was prepared to throw away every pad that I found in my house because I knew I would no longer be getting a period. But I kept them because I figured I would need them after the surgery with any type of discharge or bleeding. But to this day, and I'm almost 4 weeks post op, I have not had any type of discharge whatsoever, no bleeding, no anything. So I haven't needed them. Now, I did, they did give me some pads to wear with the mesh panties that they give you to wear in the hospital. And I took those and I did wear those at least, I think, for the first week after my surgery. To me, those are the most comfortable. I had to wear those after both of my C sections. And when I tell you, I literally would have stayed in the mesh panties with the pad if I could because they're just so comfortable. But I only wore them, like I said, for about a week. And then I was able to put on underwear, low cut underwear, so that it didn't cover my incisions. But like I said, I didn't have any bleeding or anything. Now the third week. Third week was very different, which is so crazy to me because in my mind, I'm expecting each week that goes by to get better. And I'm sure it did internally, but on the outside, it didn't feel that way. My first week and my second week were great in comparison to my third week. My third week, my belly started to itch a lot around my incisions. I was moving around a lot better than I was the first 2 weeks, but I did start to have some issues with one of my incision sites, the main one that they actually put the scope in or the camera in from the laparoscopic part. And noticed that it just looked very different than my other incision. My other incisions, the surgical tape was falling off of them, and they just looked like they were healing with no problem. But this one main incision above my navel did not look like the rest of them. And I was actually getting a little worried because I was like, I didn't want to get any type of infection or anything. So I made sure when I was getting in the shower, I didn't touch it and made sure a lot of water wasn't getting on it. But I would say maybe like the third or fourth day going into my third week of recovery, I started to get some pain and a burning sensation in my incision site. And I took ibuprofen for it. It felt like it got a little better, but not completely. And it was towards the end of the night. So I was like, if the next day I woke up and I was still having a problem, I was going to call my doctor. So I woke up the next day and I was having pain and it was hurting. And I called my doctor ASAP because it was on a Friday. And I knew if I didn't get them that Friday that I would have to wait to talk to somebody on call for the weekend. So I called first thing in the morning that Friday and I spoke to a nurse. I told her my symptoms. She asked, was there any pus? And there was no pus or anything leaking from my incision, but there was redness around it and it did feel a little swollen around it as well. But I had also just completed my medication for the possible UTI that my doctor was trying to prevent me from having. So she wanted to see if that would help with anything that was going on. She told me if the pain got worse or any drainage or pus start to come from it, to give them a call. And so I went about my day. I took the ibuprofen. Like I said, it took some of the pain off of it. So I wasn't too worried until I woke up Saturday morning. And when I woke up, oh my God, I felt like it was on fire. It was burning and it was hurting. And so I did give them a call again. I had to wait for the on-call doctor to call me back. And prior to her calling me back, I went to go use the bathroom and I looked at my incision and it indeed did have pus draining from it. So I was tempted to call again for them to page the on-call doctor again. But literally, by the time I got ready to leave the bathroom, she was calling back. I did tell her everything that was going on. It was not my doctor that was on call, so she did place a call to my doctor just to make sure that what she was going to suggest that it was the same thing that my actual surgeon that did my surgery wanted to do. So she called me back and let me know that she did go ahead and call me an antibiotic and told me that I could take the antibiotic. It would help. It sounds like I do have an infection and that I could just, pat the incision to keep the drainage from continuing to come out. But that if I had any symptoms that got worse, to give them a call and let them know. So my husband went and picked up the antibiotic for me. I started taking that. And as of today, I do feel better. This all happened within the last 2 days. And so I do have 4x4 on my incision site for now just to catch any drainage. When I checked it this morning, it wasn't draining. So I don't want anything to touch it. So I do still have it covered, but I have taken some of the medicine already and I'm actually starting to feel better. And I don't feel any pain right now currently from the incision site. So my suggestion, please make sure you pay attention to your incision sites. If there's anything that you feel or see that looks off to you, whether it's something or not, just give your doctor office a call so that you can be sure, because the last thing you want is any type of complication or setback from your surgeries. If you are considering this surgery, or if you're already planning to have this surgery, or you are currently in recovery, I hope my journey has helped you feel a little less alone if you are indeed dealing with some of the symptoms that I have dealt with. And if you are dealing with more, know that you can and will get through it. I would suggest you having something that will encourage you. For me, it was prayer and my family and friends. So make sure that you do have some support around you and something or someone that you can lean on that will help you get through this surgery, because this is something that you definitely don't want to do alone. If this video encouraged you or gave you some clarity, then you'll definitely want to catch my next video where I give you all the tips to prepare for a hysterectomy and the must-have items that you'll need for recovery. So go ahead, if you haven't already, and subscribe, and I will see you in the next one.